Hey, future nurses! Welcome back to our channel, Canadian Nurse Expert. Let's get into our NCLEX prep series. Today we're tackling a topic that often pops up, intracranial pressure, or ICP. We're going deep on 15 must-know NCLEX-RN questions about ICP. Remember, understanding this condition is crucial for providing safe and effective care to your neurological patients. So grab your notebooks, get comfy, and let's dive right in. All right, question number 1. A nurse is assessing a patient with increased ICP. Which of the following is an early sign? Is it A, a blown pupil, B, Cushing's triad, C, a change in level of consciousness, or D, absence of reflexes? Now remember, early on, those pressure changes in the brain can be subtle. The answer here is C, a change in level of consciousness. Could be anything from subtle confusion to decreased alertness. Why? Because the brain's getting compressed, and that can mess with how it functions. So pay close attention to your patient's mental status, guys. It's your early warning system. Question 2. Which condition is most likely to result in increased ICP? We've got A, a heart attack, B, a hemorrhagic stroke, C, pneumonia, or D, a urinary tract infection. Think about what we've discussed. ICP is all about pressure in the skull. So what would cause a sudden increase in pressure? You got it, it's B, a hemorrhagic stroke. That bleeding inside the brain is like a space-occupying lesion, putting the squeeze on everything else. Knowing this helps you prioritize your patients and anticipate potential complications. Question 3, everyone. The nurse is monitoring a patient with suspected increased ICP. Which vital sign change is most concerning? Is it A, a heart rate of 95, B, a respiratory rate of 22, C, a blood pressure of 140/90, or D, a widening pulse pressure with bradycardia? Now this is where things get serious. We're talking about Cushing's triad here, a late and very dangerous sign of increased ICP. And the answer is D, that widening pulse pressure with bradycardia, often accompanied by irregular respirations. This tells you the pressure's gotten so high it's starting to affect the brainstem, which controls those vital functions. This is a 5-alarm fire, people. Time to act fast. Question 4. Which intervention helps decrease ICP in a patient with a traumatic brain injury? A. Keep the head of the bed flat. B. Encourage coughing and deep breathing. C. Administer hypertonic IV fluids. Or D. Elevate the head of the bed to 30 degrees. Think about it. We want to help that brain drain fluid, right? So, the answer is D. Elevate the head of the bed. Gravity is your friend here, folks. Keeping the head flat actually makes things worse. Hypertonic fluids can cause swelling, and coughing increases pressure. Remember, we're all about reducing that pressure in the brain. Question 5. A patient with increased ICP is receiving mannitol. What's the primary goal? Is it A, to prevent seizures, B, to reduce fever, C, to decrease blood pressure, or D, to reduce cerebral edema? Mannitol is our go-to for this situation, and the answer is D, to reduce cerebral edema. It's like a sponge, pulling that excess fluid out of the brain tissue and helping to lower the pressure. Question 6. A nurse suspects brain herniation in a patient with ICP. What's the most critical finding? A, a headache, B, nausea and vomiting, C, a fixed and dilated pupil, or D, restlessness and agitation. This is a life or death situation, guys. The answer is C, a fixed and dilated pupil. That tells you the pressure is so high it's pushing the brain down, compressing the optic nerve. This is a neurosurgical emergency. Question 7. Which diagnostic test is most useful for evaluating ICP? A, a chest X-ray, B, an electrocardiogram, C, a CT scan, or D, a urinalysis. We need to see what's going on inside that skull, right? The answer is C, a CT scan. It gives us a detailed look at the brain, showing any swelling, bleeding, or structural damage. Question 8. Which nursing intervention is appropriate for a patient with cerebral edema? A, administer hypertonic saline, B, restrict fluids, C, administer hypertonic saline, or D, elevate the foot of the bed. Remember, we want to pull fluid out of the brain. The answer is C, administer hypertonic saline. It creates an osmotic gradient, drawing that excess fluid into the bloodstream where it can be excreted. Question 9. The nurse observes decerebrate posturing in a patient with a severe head injury. This indicates damage to which part of the brain? A, the cerebellum, B, the frontal lobe, C, the brainstem, or D, the occipital lobe. Decerebrate posturing, those arms and legs extended, is a bad sign. The answer is C, the brainstem. It means the damage is deep and affecting vital functions. Question 10. What's the most important goal in managing increased ICP? A. Pain relief. B. Preventing infection. C. Maintaining airway patency. Or D. Preventing brainstem herniation. While all of these are important, the absolute priority is D. Preventing brainstem herniation. That's what can quickly turn fatal, so everything we do is geared towards relieving pressure and protecting that brainstem. Question 11. Which is a modifiable risk factor for increased ICP? A. Age. B. Family history. C. Hypertension. Or D. Gender. We can't control everything, but we can control some things. The answer is C. Hypertension. High blood pressure puts stress on blood vessels everywhere, including the brain, increasing the risk of stroke and ICP. Question 12. A nurse is caring for a patient with increased ICP. Which assessment finding is the most concerning? A. A headache. B. Drowsiness. C. Projectile vomiting. Or D. Blurred vision. While all of these can occur with ICP, the most worrisome is C. Projectile vomiting. It's often a sign that the vomiting center in the brainstem is being stimulated due to the increased pressure. Question 13. Which Glasgow Coma Scale (GCS) score suggests severe brain injury? A. 15, B. 12, C. 9, or D. 6. The GCS helps us assess consciousness. The answer is D. 6. A score of 8 or less indicates severe brain injury, and we need to be prepared for rapid intervention. Question 14. Which nursing intervention should be avoided in a patient with increased ICP? A. Speaking softly. B. Dimming the lights. C. Suctioning the airway. Or D. Administering stool softeners. We want to avoid anything that could further increase pressure. The answer is C. Suctioning the airway. While sometimes necessary, it should be done cautiously and only when absolutely needed, as it can briefly spike ICP. And finally, question 15. A patient with a head injury is being monitored for signs of increased ICP. Which of the following would indicate worsening ICP? A. Tachycardia and hypotension. B. Bradycardia, hypertension, and irregular respirations. C. Decreased level of consciousness and pinpoint pupils. Or D. Hyperventilation and hypothermia. The answer here is B. Bradycardia, hypertension, and irregular respirations. This is Cushing's Triad rearing its ugly head again, telling us the pressure's getting dangerously high. That's it for our 15 NCLEX questions on ICP. You guys crushed it! Remember, mastering this topic is all about understanding the why behind the what, why each sign and symptom occurs, and why each intervention is important. Keep practicing, keep reviewing, and stay tuned for more NCLEX study videos. I'm here to support you every step of the way. Now go out there and rock that NCLEX.